everybody. Hi everybody. This is just a test to see how the video recording would go if we wanted to do these so people could watch them in their free time. So we just want to make sure that you give us our feedback and see if this was worth the time put into it to make it. So today we're just going to talk a little bit about the flow of advocacy. And so what's going to happen is we'll start with the Street Side Advocacy folder, which you should all have a link to. And inside of there is a folder, Flow of Advocacy. And inside of this folder with a bunch of stuff, over here at the far right for now is what's called General Procedures. And that's what we're really going to be going off of today. So when I'm going through this, I just kind of want you guys to follow along. And if you have any questions at any time, just please let me know, and we will fix it in the video in the future. And yeah, so the general procedures of advocacy. Before clinic starts, what do you do? So you sign in. Every week there will be a sign-in sheet that the coordinators take care of, and the sheet kind of changes the way that it looks. Most of the time it's fairly formal sign-in sheet, but sometimes it's a sheet of paper, just depending on whether or not someone made copies that week. So that'll be very easy. Whoever the lead advocate is that week will help you, or you can just simply ask the coordinator, hey, should I sign in? So the next step that you'll be doing before you start clinic is you're going to make sure that there are copies of the necessary forms. So these may overlap with coordinator forms, and there's quite a few of them. So each one of these little blue things here is a hyperlink to the different forms. I'm not going to go over all of these forms right now, just because I think it will take too much time, and we're going to be showing each one individually in a different video. But the two I want you to kind of look at, and we're going to be using outside of this number 4 here, advocacy intake, is going to be the consent for services and the service unit log. So this is going to be the service unit log. And the service unit log is going to be important because we're going to try to use this as a tracking tool to help link what advocates do with what the case management staff at Prevention Point does, because they need a sustainable way to know what advocates did with patients that come in, whether it was a housing referral, whether it was a drug treatment referral, whatever the case is. And this is what they currently use in order to keep track of their patients due to the client's name, their unique ID, and then you'll put the date and everything like that. So we will go over that more later, but for right now I just want you to see what it looks like. The next one that's going to be important is we want every patient to sign one of these, especially if we're doing advocacy work. So basically what this paper is going to be the consent for services form. And the reason that this is so important is that it basically tells patients that they have the right to privacy and that we will not release any of their information without them knowing, but it also gives us a workable relationship with the patient and able to access some forms of their information just within Prevention Point itself. And it's just a good way to get one consent form down so that people understand that, we'll be working with them and we don't run into any like HIPAA violations or anything like that along the way. So as we go down, if you can make sure to have copies of these, which once you follow the hyperlinks, you'll be able to see what they look like. We're going to ask you to sign into Prevention Point, Google Drive, and I'm going to kind of take you through that process. So let me just close these. So signing into Prevention Point. So when you get to one of the computers, or if you're using your laptop or an iPad, which we'll talk more about at the beginning of the year, what people feel comfortable with, what you're going to be typing in is Google Drive, google.com. And so this can be accessed through one of the computers that is in the patient's room. However, right now we're having a problem with computer and room space just because we need to make sure clinic keeps flowing. And we'll talk a little bit more about that later. So how this is going to start is you're just going to have dropinpp@gmail.com. Next, I already have it on my computer, so what you'll type in for the password is prevention point. So in the course of the day, this is very important because what ends up happening is this is the way that we see when patients are coming in, because the flow of how clinic and prevention point works is people come into what's called the drop-in center, and there's a front desk there that they'll go up to and sign in with what they want for the day. And so what we're primarily looking up is clinic sign-in sheets. So you'll click clinic sign-up sheets, and then you'll go down to whatever the month is, and currently it's July. So we'll go into July, and I just made a copy of this so that there was no patient information available. And so this is kind of what it's going to look like when you sign in and when you go to the date that you're looking for. And so this is very important for us because it's going to be what we're using for pre-screening. And so you may be asking, like, what pre-screening is. So the general idea behind pre-screening is it's a way for advocates to see what patients may need and a way for them to start a conversation and prepare ourselves before going in. So one way that we can do this is by not what I wanted to happen. So one way we can do this All right, sorry about that. One way we can do this is by using that intake form in order to identify things. So this is the example that you'll be looking at. And what will be happening is in real time, people will hopefully be updating it from the front desk. So what that may look like is, say that, a new patient comes in and you see scrolling across the front, like Kate pops up. Their unique identifier is going to be their last name, whatever that is, and the last four of their social security number. So as this information comes up, you'll be able to see what we're really looking for the pre-screening. So does patient have insurance? And so maybe the patient does have insurance. So we can use this as a pre-screening tool to know that, okay, we don't necessarily need to have that conversation with the patient about whether or not they're looking for insurance today, which is something we really want to make sure that every patient is able to get. And so patient been here before. That's not super important for us, more for coordinators. And then the forms being completed and the housing status are all things that are variably filled out. Forms being completed is important for us because we're going to be using that form as a next level for pre-screening. And the months since being tested is important because if you look up there, anytime that it's been 3 months or so before you have had a HCV test, is that you want to get a new testing done. So every 3 months, people should be coming in to get HCV tests done. It's unlikely that people are going to do that. Some people do, but if you see that they're at 1 month, it means that no, they don't need an HCV test. They've had it within the window. But if they're at 4 months, they're outside of the window and they should be offered retesting. So that's kind of the first thing that you'll do in order to do pre-screening. So the next type of pre-screening tool that you're really going to be using is going to be the demographics and testing form. So before we use that, one thing to really look at is going to be the street side advocacy intake form. And this is important because this is pretty much the foundation of how we're going to approach patients. So when you're doing the pre-screening that we were talking about, this is really what you're going to be using in order to make sure that you understand this is what needs to be offered to patients. And the way the intake form is set up currently, and this is a copy that started to be done by Kate, is that we have things that can be provided by an advocate that's going to be in white, and then the gray blocks are going to be the ones that only the case managers will be able to help with, and also ones that just say CM currently are the ones that only case management can help with, and advocates cannot really do much with and will refer out to a case manager. So with that being said, say that you were taking a look at the intake form for Jon Snow and you saw that he did not have insurance, and so you wanted to have a discussion with him about insurance. So you would come down to insurance and check this box while you're looking, and that's going to be part of your pre-screening measure. And so when you check this box, even if you're not the one who's going to be seeing the patient, inevitably people know that they have some type of thing that popped up on their list, whether it was through the first thing I showed you or through the next things I'm going to go through, that they should put here on the intake form. So if we take a look at the testing form, this is going to be a huge bunch of statistics and demographics that are going on that are going to be very important. But when you first look at it, the things in purple are really the things that we're looking at right away. So if you're looking at the dress, and the dress is going to be the same that they have at Prevention Point. So a lot of people will use Prevention Point's address, which is 2913 Kensington Avenue, as their main address. And if they're using that, it doesn't mean they're homeless, but it's likely that they could be. And if they haven't filled it out at all, we can assume that they're having at least, variable housing problems. So it's something that you can mark down on the intake form we just looked at. And so that's very important. And then if you go down here, another really quick screening measure is going to be overdose history. So another fundamental thing that we want to do is make sure that everyone that comes to Prevention Point has the knowledge to do and to use Narcan. And so with that in mind, if you kind of look at the overdose history, you'll be able to see, like, in the past year, have you seen overdoses? Yes, like right there, that's already a criteria that's pretty much meant for being able to learn and wanting to learn Narcan. And as you go through this, the higher the numbers are that's checked next to the yes are going to be the more urgent it probably is for the person to get Narcan training and where it falls on the list of things you feel you need to bring up with the person. And so we're still working on how to train clients that come in, or I guess start the discussion for training clients that come in. So those are two of the big things that you can look at, is the purple on this. And also, this is the demographics form. So the other one was the testing form. And so this is going to be big for the purple areas as well. And so this is important because if you look at the insurance, they could put no right away, which in this case with Jon Snow, what we're mimicking is that he does not have insurance, which we definitely want to make sure that he gets. And so if they are getting a medical assessment form filled out, is very common to do, even if they have a chief complaint that's bringing them in today, then that's something we want to make sure gets done. And we would also want to try to help them get linked up with a Compass application, which is going to be the welfare application that we're going to help people fill out, or at the very least, case management is going to help people fill out in order to make sure that they get the insurance that they need. And so a lot of this other demographic stuff falls under testing for HIV and hepatitis C. So that's not our main concern because there's testers available for that. Do you have a primary care doctor? No. So right now we're working on a primary care referral list. And hopefully by the start of the year, that's up and running. So if there's a no, we are going to work with the patient in order to make sure that we can link them to a primary care provider that they feel is suitable for them within distance and everything like that. So this is kind of more about the prevention with the Narcan training again. And if they're checking no's to these, then, you're going to want to start that conversation, especially if they're interested and they put yes down here. So another portion that we haven't got to yet, but we're going to in the future, is wound care, which is abscesses and soft skin or tissue damage, which is very common to have for people that may be injecting and doing things that are called skin popping, which is injecting under the skin, and a variety of other ways, even just injecting regularly. It can be common for people to form abscesses. So we want to be able to provide good wound care, but we're not quite at that level yet. So as you're going through this and you're kind of doing these pre-screening things, I want you to keep in mind that you're going to be checking these off at the intake form. And so up top, you'll be seeing that the clinic room, so in this case, John Snow is in clinic room 3, and the housing status is homeless based upon what you did with your pre-screening. And these offered are all going to be things that maybe you got through the pre-screening, or maybe a medical student talking to them came out and seemed to note was important just in talking with you before you went in to talk with them, or maybe just through you talking to them about it. So with that, you would put in the offered all these red check boxes, and then once you're talking to them, hopefully it's accepted. And if it's not accepted, we want to make sure that we make a copy, or we continue a copy of this probably through the survey unit log, so that case management knows that we offered a service that may or may not have been accepted. So those are all very important things in order to understand the flow of advocacy, because the flow of advocacy is based upon these general forms. And the way these forms are going to be used is that when you first come in, I showed you the login process, then I showed you the intake, so you'll be sitting with a lead advocate and you'll probably all be looking at this intake sheet together that Prevention Point is updating in real time, and you'll be filling out your pre-screening measures. So then when the patient is being brought back, or just their paperwork is brought back, which is very important, you're going to be able to check the paperwork out, as we were kind of looking at, and identify a couple other pre-screening things before you actually go in and start talking to a patient. And so that's kind of what we wanted to talk about with you today. And if you have any other questions or comments, just let us know. And since this was just a sample, just let us know if there's anything we can do to make it better in the future.